A group of friends celebrate receiving their coronavirus vaccinations in New Delhi. They're some of the lucky ones who managed to get an appointment. Signs at many vaccine centres around the country read they are out of doses. Despite having a population of 20 million people, India's financial capital Mumbai only has 20,000 doses for those between the ages of 18 to 45.
We were told that it would be a first-come, first-served thing here, but the vaccination center here is deserted. We will see what we're going to do, whether we will get it or not.
The government said everyone above the age of 18 would be eligible for a vaccine from Saturday, but most regional leaders say they don't have enough doses to expand the program. The sign reads, "Welcome to the world's largest vaccination drive," but despite India being the world's largest vaccine manufacturer, it can't supply enough doses to its people. This is one of just a handful of private hospitals in New Delhi that were able to procure vaccines to inoculate people between the ages of 18 to 45 on Saturday. The online registration also isn't accessible for the hundreds of millions of Indians who don't own computers or smartphones and don't have an internet connection. India is also running short on oxygen despite international aid arriving. On Saturday, staff at one hospital in New Delhi said patients had died, including one of their doctors, when an oxygen delivery was late.
हमारे हाथ में जो है वो तो हम कर रहे हैं.
We are doing what we can, but we can't think about what we can't control. For God's sake, please try to organize oxygen for us. There was a gap of 45 minutes when we didn't have oxygen. We did everything we could. We used all our cylinders, but despite that, we couldn't save 6 of our ICU patients.
The death toll later went up to at least 12. Health experts are asking the government to impose more restrictions to ease the pressure on the healthcare system.
Currently, I think India has to step up its containment measures. These measures will have to be very aggressive, and we should also have localized lockdown wherever necessary to get at least the transmission arrested.
Scientific advisors appointed by the government say they warned officials in early March of a new and more contagious variant of the coronavirus. Despite that, the government didn't impose restrictions and allowed people to gather at large political and religious events. Elizabeth Puranam, Al Jazeera, New Delhi.